Cleveland HeartLab is a premier, next-generation clinical reference laboratory committed to advancing cardiovascular risk assessment through unique and novel diagnostic tests. Cleveland HeartLab operates a CLIA-certified and CAP-accredited clinical reference laboratory. We offer inflammatory and other advanced biomarker testing that practitioners from across the United States use in the management and prevention of heart disease. Cleveland HeartLab is committed to providing high-quality results. A key component to this is receiving high-quality samples. This educational video will provide instructions on how to properly fill out a requisition form, how to collect the blood and urine samples, and how to properly process and ship the samples to Cleveland HeartLab. The sample handling process begins with a Cleveland HeartLab requisition form. It is important that the requisition form is filled out completely with the following. Practitioner information. We require the practitioner's full name and the practice name. If this is your first time ordering from us, we will also need the ordering practitioner's NPI number. Complete patient information is needed, including full name, as it appears on their insurance card, no nicknames, patient gender, patient date of birth, patient address, and the last 4 digits of their Social Security number. We use this as a unique identifier for historical reporting. For your convenience, we have provided fields for height, weight, BMI, fasting status, and race. This information will appear on your patient's reports along with the results. Patient insurance information. Please provide us with a clear copy of the patient's insurance card. Please be sure to mark all appropriate ICD-9 codes on the requisition form. Please provide draw date, time, and phlebotomist's initials. Draw date and time are required to ensure the sample is still within the proper time frame for accurate resulting. Draw date is also required to submit a Medicare claim. If any information is missing, it may cause a delay in processing the sample. You are now ready to draw the patient. Utilize the requisition form and sample handling quick reference card to identify all the tubes needed for the patient. Confirm with the patient their name and date of birth. After collecting the sample, label the tubes with this information and write in the draw date. We will now review the sample handling for each tube type. SST Tiger Top Tube. We will now demonstrate the sample handling process for a serum separator tube, also known as an SST or Tiger Top. This process is also the same for the NMR lipo profile tube. It is important that you draw the SST tube first, in most cases, because of possible cross-contamination due to anticoagulant present in other tubes, such as the EDTA lavender top. Once a full tube has been drawn, gently invert 5 times immediately after draw. Then label the tube with the patient's last name, first name, and date of birth. It is essential that the patient is present when the tube is labeled. Allow the blood in the tube to clot by setting aside for 30 minutes at room temperature. After the sample has been sitting for 30 minutes, centrifuge at 1300 RCFs for 10 minutes. Please make sure to properly balance the centrifuge. Place the tube into a refrigerator until ready for shipping. Some examples of tests that are run on the SST tube are vitamin D, ApoB, ApoA1, lipoprotein a, and a lipid panel. EDTA lavender top tube. Next, we will discuss the sample handling process for an EDTA lavender top tube. Once a full tube has been drawn, gently invert the tube 8 to 10 times immediately after draw. Then label the tube with the patient's last name, first name, and date of birth. For a whole blood sample, the tube will not need to be centrifuged. Do not open or agitate the tube after it is placed in the rack. Place in the refrigerator until the samples are ready to be shipped. Some examples of tests that are run on the whole blood sample are hemoglobin A1C, CBC, and CBC with DIF. Genetics testing requires a single separate whole blood EDTA lavender tube. Examples of genetic tests are ApoE, CYP2C19, and MTHFR. For an EDTA plasma sample, after gently inverting 8 to 10 times, immediately centrifuge at 1300 RCFs for 10 minutes. Once centrifuging is complete, open the tube, remove the plasma, the top layer, using a polypropylene transfer pipette. To do this, place the pipette 2/3 down into the plasma, making sure not to penetrate the red cell layer. Next, transfer the plasma into a transport tube and label the transport tube with the patient's last name, first name, and the date of birth. Write plasma EDTA on the tube. Discard the parent lavender tube. Some examples of tests that are run on the plasma sample are myeloperoxidase, high sensitivity CRP, and LP-PLA2, also referred to as the plaque test. Urine collection. Now we will discuss the process for urine collection. Use a blue top urine vacutainer cup. Collect random urine from a patient, peel off the yellow label, invert either the cherry red yellow top test tube or yellow top test tube and place it onto the needle, allowing the urine to transfer into the desired tube. Once the tube is filled, discard the blue top urine vacutainer cup. Next, label the urine tube with the patient's last name, first name, and date of birth. There are 2 different tubes that can be used for urine collection depending on the test being run. The yellow top urine sample tube can be used for tests including F2 isoprostane creatinine ratio and microalbumin creatinine ratio. The cherry red yellow top tube, which contains a preservative, is used for the urinalysis test and should be gently inverted 8 to 10 times. Both tubes are needed for the aspirin works test. For a complete listing of our tests, listed by tube type, please reference our sample handling one-page card or reference our test menu on our website. Storage of samples. Once you have collected all the tubes necessary for desired testing, place all labeled tubes in a biohazard bag and place the corresponding requisition form with a copy of the patient's insurance information in the front pocket of the biohazard bag. There should only be 1 patient per biohazard bag. Keep all the samples in a refrigerator until they are ready to be shipped to Cleveland HeartLab. Shipping. Cleveland HeartLab will provide all the necessary materials to ship samples. The materials include a styrofoam box, ice pack, biohazard bag, tube labels, a UPS shipping bag, and a prepaid UPS shipping label. When ready to ship the samples to Cleveland HeartLab, place the biohazard bag filled with tubes into the styrofoam box. Please place a protective barrier such as the requisition form or paper towels between patient samples and the frozen ice packs to protect the integrity of the whole blood samples. Place 1 or more frozen ice packs into the styrofoam box based on package size and projected weather conditions. Place the styrofoam lid onto the box, then place the box into the provided UPS shipping bag and seal. Once sealed, place the prepaid shipping label onto the outer shipping bag. Write down the tracking number for your records. Rejection policy. Cleveland HeartLab adheres to the CAP and CLIA regulatory standards. If the preceding instructions are not carefully followed, your specimens may be rejected. Samples will be rejected for any of the following reasons. Samples were shipped on Saturday. Friday blood draws arrived on Monday. Sample types were incorrect or samples were received in damaged condition. For example, a tube arrived open or cracked, or the sample was not at the correct temperature. The sample tube is not properly labeled with first and last name and date of birth. The requisition form is not completely filled out. First and last name, date of birth, and gender are required. The practitioner's signature is missing. Preventing sample handling errors. This list provides examples of commonly encountered sample handling errors that can result in a test that is unable to be performed or delays in reporting. No date of birth. Some reference ranges are based on age. If no date of birth is given, we are unable to result these tests. No gender marked on requisition form. Some reference ranges are gender specific. If no gender is given, we are unable to result these tests. Incomplete name. A complete name on the requisition form and each tube is critical for patient and specimen identification. A complete name is also needed to file the insurance claim. No draw date. The draw date is required per CAP CLIA regulation. This will ensure both the quality of your samples and reliability of your results. There is a place for the draw date on the left-hand side of the requisition. Improper labeling or no label on tubes. Before you send your samples to Cleveland HeartLab, please make sure each tube is labeled with the patient's first and last name and date of birth. When sending a transport tube, please include the sample type on the label. Incorrect specimen type will result in erroneous results for your patients and significantly impact patient care. No test checked off or ordered on requisition form. If a requisition form is received without a test ordered, it will be put aside and the office will be contacted to send in a new requisition form. This may result in delayed or expired samples. Incorrect whole blood sample handling. For whole blood, draw the patient and gently invert the sample 8 to 10 times. Do not shake or centrifuge the sample. Do not spin down the sample and remove the plasma. Failure to follow these whole blood sample guidelines will result in erroneous results. Not allowing the SST tube to clot for 30 minutes. The SST tube needs to sit for 30 minutes at room temperature in order for the chemical activator in the tube to initiate clot formation. Inadequate clot formation could result in invalid results due to poor serum cell separation. At Cleveland HeartLab, we pride ourselves in running a CLIA-certified and CAP-accredited clinical reference laboratory. We focus on providing a high-quality service experience and take care in receiving and handling your sample. If you have any questions regarding sample handling, please contact customer support at 866-358-9828 or visit our website at www.clevelandheartlab.com.